Welcome to your benefits enrollment for AM Technical Solutions. In this presentation, we will walk through your plan options. More detailed information for your programs are available in ProLiant. Please review the documents posted as well as your employee benefits guide. The AM Technical Plan Year runs August 1st through July 31st, 2025. Your insurance is effective on first of the month following 30 days of employment. So you will need to go into the ProLiant portal to make your elections for the upcoming plan year. They will remain in effect until July 31st. So the only way you can make changes to your coverage throughout the year is if you experience a qualifying life event. You can see some of the examples of life events listed. If you get married, have a baby, spouse loses coverage and needs to come onto your plan, be sure and reach out to HR and make your change within 30 days of the qualifying event. Otherwise, you will have to wait until open enrollment next year. And just a note as to who is eligible for your plan. So eligible dependents are your spouse, common law spouse, or children. Eligible dependents do not include domestic partners and those that are of civil union. So now we will go through all of the details of the various plans you have available to you. So your medical plan is through Blue Cross Blue Shield. If you enroll in the high deductible health plan, you do have two medical options. But if you enroll the high deductible, then you will also have access to a health reimbursement account as well as a health savings account. Your dental plan is also administered by Blue Cross Blue Shield. Your vision plan is through United Healthcare. Your life and disability will be administered by Mutual of Omaha. And your critical illness, cancer, and accident voluntary programs are administered by Allstate. So during the year, you have access to Gallagher's Benefit Advocate Center. So should you have a question regarding benefits or claim questions, maybe you've received some explanation of benefits in the mail and you aren't exactly if it was processed correctly or what you owe to which provider, then give them a call or send an email and they will be happy to help you out. And the team of benefit advocates are available to you all year long. So first we'll be going through your medical plans. You can see here your biweekly rates. So if you are enrolled in the wellness program, you can see those rates versus the non-wellness rates. So first we will go through your high deductible health plan. This is eligible for a health savings account. So we will go through the banking piece in just a bit, but first we'll go through the details of the high deductible plan. So you can see that preventive care is covered at 100%, but all other expenses do apply towards your deductible. And then once deductible has been met, claims are covered at 100%. So you do have a $6,350 individual deductible. However, anything above $3,500 can be reimbursed through your health reimbursement account. If you're covering family members, the maximum is $12,700, but again, you have a health reimbursement account that helps you meet that deductible. So anything above $7,000 is reimbursable for your family. But one person will never exceed more than the individual deductible amount if you are covering family members. So with this plan, you will pay the in-network contracted rate as you go to see your in-network providers. Discounts will apply, and that is the amount that will apply towards your deductible. Again, with the exception of preventive care, it will always be covered at 100%. So now let's take a look at your biomedical option. This plan does have copays. So the calendar year deductible is $5,000. So that deductible applies to anything done in the hospital, outpatient surgery, MRIs, CAT scans, things of that nature. Otherwise, on this plan, you will have copays associated with your visits. So for your physician visits, if you see a specialist, it will be a $100 copay. However, if you go to your primary care physician, it is a $0 copay. So that will be covered fully for you. The same thing applies to your virtual visits. Should you need to go to urgent care, that is a $50 copay. And then for the emergency room, you will get at least 2 bills when you go to the ER. The facility charge, you'll pay a $250 copay plus 20%, but your physician charges will apply towards your deductible, and then you will pay 20%. So let's say you have a hospital stay or a surgery. Once you meet your deductible, and any coinsurance or copays apply to your out-of-pocket maximum, then at that point, Blue Cross will cover the rest of your claims at 100% for the rest of the calendar year. So out-of-pocket maximum on this plan is $6,500 for individual and then $13,000 for family. But again, if I'm covering dependents, one person will never exceed more than the individual amount. You can see at the bottom the various copays for prescription drugs. So depending upon if you are taking a preferred or non-preferred drug, which copay will apply. If you are enrolled in the high deductible health plan, because AMTS realizes that $6,350 is such a high deductible to be met before claims are paid, we offer a reimbursement program to assist you with those expenses. So once you have met more than $3,500 in deductible expenses, you can submit a claim form along with your explanation of benefits to CPI, at which point they will reimburse you anything above the $3,500 amount, up to $2,850 for individual or $5,700 for family. So these funds are paid directly to you once you submit your claim form and your explanation of benefits. The high deductible health plan also gives you the eligibility to participate in a health savings account. So the health savings account allows you to reduce your taxable income for expenses you know you may have, or you want to set aside funds in the event you have expenses later on down the road. Because with this plan, there's not a use it or lose it provision. Once I deposit the money into the account, it is mine until I use it. Should I leave AM Technical at some point, then I take the savings account with me, because it is a true savings account. And that money, your account can grow year over year. You can use it like another retirement account if you choose to just continue saving the money in that account. But the funds in that account can be used for medical, dental, and vision expenses for you and your dependents. As long as they are your tax dependents, you can reimburse yourself for their expenses, even if they're not covered on your plan. So to be eligible, you do have to be enrolled in a high deductible plan. You also can't be covered by another plan that's not HSA qualified. So I can't be enrolled in my spouse's plan if it's a copay plan, or Medicare or TRICARE. In addition, if my spouse is enrolled in a flexible spending account, I do need to wait until their plan year is over before I can start contributing into my health savings account. Since we are each other's tax dependents, their FSA funds could be used on my expenses. So you can see the calendar year maximums at the bottom. They are increasing for 2025, but you can see the current 2024 amounts here listed as well. For those of you that are actively contributing into your HSA, then AM Technical will provide you with a $10 up to a $10 health credit per pay period that you will see through payroll deductions. For the wellness incentive, AM Technical Solutions does provide you a wellness incentive for your contributions to your medical plans. So to participate, you must download a copy of your annual wellness exam form from Proliant and have this completed and signed by your physician during your annual wellness exam. So return the form to HR within 90 days of your insurance effective date if you're a new employee, and then annually thereafter to receive the financial incentive that considerably lowers your premium cost for your medical plans. There is no confidential information that is exchanged. Only the thing shown is proof that you had your wellness exam with verification of the date and then the signature of the physician. Your dental plan will be administered by Blue Cross Blue Shield. So you do have preventive care services covered at 100%. Should you need basic or major services, then once you've paid the $50 deductible, basic services are covered at 80%, and then major services are covered at 50%. Any person I have covered on my dental plan has up to $2,500 to use per calendar year. So that restarts every January 1st. Adults and dependent children are covered for orthodontia benefits. So should you need orthodontia care, the plan will pay 50% up to $1,000 lifetime maximum benefit. So that doesn't restart each January 1. It's just a one-time benefit per person. So to find your in-network dentist, you will go to the Blue Cross Blue Shield website and select the Blue Care Dental Network to see all of your in-network dentists in your area. Now, your vision plan will be administered by United Healthcare. So United Healthcare will pay for glasses or contacts. They won't pay for both in the same year. But you have your exam that can be covered every 12 months with a $10 copay. And then if you opt for glasses, then you will pay a $10 copay for your lenses. For your frames, United Healthcare will pay up to a $100 allowance and then give you a 30% discount on everything above and beyond that. If you opt for contacts instead of glasses, then if you select from their formulary list of all the various brands that they have covered in formulary, they will pay up to 6 boxes of contact lenses. If you have a contact lens that is not in their formulary selection, then they will pay up to $150 on your contacts. So again, your exam's covered every 12 months. It is based on your last exam date. So once 12 months have passed, then you will be eligible for another one. Same thing for your lenses, and then frames are covered every 24 months. Your life and disability plans will be offered through Mutual of Omaha. So AM Technical Solutions provides all benefit eligible employees with $50,000 of life insurance and accidental death and dismemberment. If you would like to purchase additional life insurance on top of what the company provides, then you can do so through payroll deductions. If you make an election for yourself, then you can elect coverage for your spouse and children. As a new hire, there are guaranteed issue amounts that are in place. Once you are out of your new hire period, if open enrollment next year, you would like to add coverage, then you will need to complete the evidence of insurability form. You could increase each year open enrollment by $10,000 as long as it remains under the $150 threshold that was your new hire guaranteed issue amount. You will see the elections you're able to make as you go through the Proliant portal because it is based on your salary and then also your age to determine the rate. So once you go through, you will see the various rates for you, your spouse, and children. Should you become disabled while you're an employee at AM Technical, then you will be provided benefits of 60% of your income up to $1,500 per week for short-term disability. Once you've been disabled for 14 days, then your benefits will begin on the 15th day. The maximum benefit duration is up to 11 weeks, but your physician will deem you disabled for a certain period of time, and that determines what your benefit duration is. However, if you do go up to that maximum, then it will roll over to long-term disability if you're still deemed disabled at that point and pay you 60% up to $10,000 per month. It can last up to Social Security normal retirement age if you are deemed disabled that long. One thing to note, if you are a new hire, pre-existing condition, anything treated or diagnosed 3 months prior to your effective date won't be covered for the first 12 months. Everything else will be. Now you have voluntary benefit plans available to you. So cancer, critical illness, and accident plans will now be discussed. So these plans work a little bit differently than your medical plans, where medical plans pay your provider directly. These plans pay you a benefit directly. So if I select the cancer insurance and I am diagnosed with cancer, then I would be paid a $4,000 benefit for that initial diagnosis. Then depending upon the treatment I have, after a diagnosis is made, will determine what other benefits I will receive that you can see listed here. One great thing about this plan is that you also have a wellness benefit that will pay you $100 when you have your annual exam. So that will apply to you and your spouse if you are covering your spouse as well. So you would get $100 per person per calendar year for having your wellness exam, which can also reduce your medical cost on your premium. So that is your cancer benefits are age-based. So when you go through ProLiant, you will be able to see the amount per pay period, should you want to apply. And then for critical illness, you're able to select either a $10,000 or $20,000 benefit. You can also cover spouse and children. So should you be diagnosed with one of these critical illnesses, then you will be paid a lump sum upon diagnosis. And then again, if your spouse or children are covered, that benefit would be payable as well should they be diagnosed with a critical illness. So the rates will be shown in ProLiant as you go through the system for the critical illness plan as well. For your accident insurance, this is for off-the-job accidents that will pay you directly. Once an accident occurs, should you need to take a child to the emergency room, or they have a fracture, dislocation, or need crutches, you can see the various amounts that you would receive should you need to have those services from an accident. If you have kids in sports, I do recommend it. I've used it on my children twice this last year due to sport injuries, or if you have a very active lifestyle, it's something great to have to provide yourself some benefits when one of these accidents occur. This plan actually does also have a wellness benefit that is $50 per person covered on your plan. So you will see the cost as you go through the system. But in addition, take a look at the benefit guide for additional details and information on these various plans, because what I'm going over is just a very high level of the benefit offerings. So your next steps are to enroll in ProLiant within 30 days of your new hire effective date. Take a look at all of the materials available in ProLiant. Make sure to confirm that your physicians and dentists are in network in order to get the best benefit. And then complete your evidence of insurability form for the voluntary life insurance if it is required. Thank you so much for your attention today. Should you have any questions, please reach out to the benefit advocate team, or if it's a question regarding enrollment in ProLiant, please reach out to your HR team. Thank you.